Hi everybody, it's Dr. Karkhanis here from San Antonio, Allergy, Asthma and Immunology Associates. Thank you for logging on to our event. This is a Ask the Doctor regarding COVID-19 vaccine. It's a very informal, informational session, and I'm going to keep it very simple so that everybody logging in can understand. And you please feel free to send us your questions as you listen to our talk. We will try and answer them. We will have a Q&A session once I'm done talking, and then we will try and answer your questions. If we are not able to get to your question, we will get back to you with the answer. We will be posting the video as well later, and we will have a FAQ list put up, frequently asked questions list put up as well. In case you missed something, you can go back and refer to that as well. So before we talk about COVID-19 vaccines, we need to just read up a little bit, refresh our memories as to what's going on. So what is COVID-19? So the COVID-19 pandemic, also known as the coronavirus pandemic, it is an ongoing pandemic of coronavirus disease 2019 caused by the virus called severe acute respiratory syndrome coronavirus 2. So SARS-CoV-2 is the name of the virus, and the disease is called COVID-19. This disease and virus was first identified a year ago, December 2019, in Wuhan, China. And in March 2020, the WHO declared the outbreak a pandemic because it had spread worldwide to great proportions. As of yesterday, there have been more than 80 million cases of COVID-19 in the world and more than 1.75 million deaths due to COVID-19. So this pandemic has really caused the biggest disruption, global, social, and economic, including the largest global recession since the Great Depression. So what is this virus, right? This is a very simplified picture of this SARS-CoV-2 virus, okay? It comes from a family called coronaviruses. Majority of these coronaviruses are our common cold viruses, and we don't really worry about them. They don't cause severe diseases. They are enveloped, so these viruses do have an envelope around them, and they have an RNA inside them. So if you think back to genetics, human beings have DNA. Our genes are stored as DNA. But some viruses, including this COVID-19 virus, has a RNA. It does not have any DNA. And it's really, really tiny. So the RNA is 30,000 bases in length. And the whole viral particle, which is called the virion, is about 50 to 200 nanometers in diameter. And just to give you a comparison, 1 millimeter is 1 million nanometers. So you can imagine how tiny this virus is. It has 4 main proteins: the spike protein, the envelope protein, the membrane protein, and the nucleocapsid protein. And this is kind of important to touch base on here because the spike protein is what the vaccines currently approved are targeting. And it uses various receptors or structures that already exist on our cells to enter our cells once we catch the COVID infection. And 2 of the well-known ones are what are called the ACE receptors and another one called basogen. Now, a quick flashback to our high school biology class, right? So if you look at a diagram of the human cell, if this is your cell, right, it has its own cell membrane. And then it has a very specialized structure inside called the nucleus, which has its own nuclear membrane. And inside the nucleus is where all our DNA sits, okay? And the nucleus is like a safe inside your house. So just any random piece of paper that enters your house can't really make its way to your safe. It requires somebody who knows the combination, knows where the safe is to deliberately put it inside. Similarly, our DNA is very protected inside our nucleus, and there are various other structures outside the nucleus, still inside the cell, in the cytoplasm, and they have various names like mitochondria, endoplasmic reticulum, lysosomes, Golgi apparatus. These cannot go inside the nucleus. The nucleus is very, very protected. This is important to know because your vaccine, which is a RNA vaccine, is only going to enter the cytoplasm and it cannot go inside the nucleus. So for people that are concerned about whether the vaccine RNA is going to join their own DNA, it cannot. It just cannot enter the nucleus. It's a one-way street. Things can come out like mRNA, but mRNA cannot go back in. What happens to mRNA, right? What is mRNA? So our bodies didn't start working with mRNA this year because we had a COVID pandemic and we made mRNA vaccines, right? Our cells are constantly using mRNA to make protein. So our cells have a special little factory called a ribosome that picks up this mRNA that exits out of our nucleus, right? And then along with various structures, it starts attaching little bits of amino acids in a particular order, depending on what is written in the mRNA. And as these amino acids get joined, we form proteins. This is literally how every bit of us is made, including our skin and bones and organs and hormones, and every little molecule of us is made from mRNA being converted to protein. So our cells are very, very used to this. This is what they do. They are literally factories to make proteins from mRNA. So making protein from mRNA is nothing new to them, and nothing bad usually comes off of it because this is how we live. Now, what happens when we catch a coronavirus infection, right? So let me simplify the process, okay? Imagine this is the virus, the SARS-CoV-2 virus. It has its envelope, it has its RNA inside, and then it has these little spike proteins. These are important because these are the ones that attach to our cells. They stick to the receptors and they help this virus enter inside our cell, penetrate that first line of defense, which is our cell membrane. Once that virus is inside, it releases its RNA. So RNA doesn't come just from vaccines. When you catch an actual coronavirus infection, also what you get is RNA inside the cell that comes from the virus. And then that little factory we talked about, the ribosome, starts making proteins. Now this is a live virus infection we are talking about here. So it actually starts making all the proteins, and it starts making more copies of itself. And then those proteins start forming new virus particles that then release from this cell. They go and infect the next cell. And that is essentially how a viral infection invades our body. Cell after cell, it releases its RNA inside. It uses our body's machinery to make its proteins, and it goes and infects the next cell. What is a vaccine now? So before we move on to talking about coronavirus vaccines, what is a vaccine? So a vaccine is a biological preparation that provides active acquired immunity to any particular infectious disease. Typically, it contains an agent that resembles the disease-causing microorganism. It can be made from weakened or killed forms of that microorganism. It can be made from its toxins, or it can be made from one of its surface proteins. So the COVID-19 vaccine is made from one of the surface proteins. The idea is to stimulate the body's immune system to recognize that agent in the vaccine as a threat and try to destroy it, and then to further recognize and destroy any similar microorganisms that may come later, that the body may encounter in the future. So think about it this way. Getting a vaccine is like doing a targeted controlled military training exercise for the soldiers of your immune system. Versus catching an infection unvaccinated is just all-out war in your body with untrained soldiers. Vaccination is the most effective method of preventing infectious diseases, and widespread immunity due to vaccination is largely responsible for the worldwide eradication of smallpox and restriction of diseases such as polio, measles, and tetanus from much of the world. So vaccination works. We know that already from all of these diseases that we have been able to control. Currently, we have licensed vaccines for 29 different human infections. The latest one is the COVID-19 virus. what are various types of vaccines that we have so far, right? So we have this very popular currently DNA and RNA vaccines, and we are going to talk more about the mRNA vaccines that have been formed for coronavirus. But we have for other diseases a live attenuated vaccine, which we basically took a weakened version of the virus. For example, there is a live polio vaccine used in some countries, not in the US. We have inactivated vaccines. For example, the flu vaccine, where we've taken the flu virus and we have killed it with heat or chemicals. We have subunit vaccines like the hepatitis B vaccine. And then we have viral vector vaccine. So this is another type of vaccine currently in development for coronavirus, where they take a harmless cold virus from chimpanzees and they put the coronavirus gene inside it. We are going to talk more about the mRNA vaccines that we currently have available to us. So how do these mRNA vaccines work? So imagine this is the mRNA that's been made by the vaccine manufacturer. It has the genetic code for the coronavirus spike protein in it. It's going to enter your cell, and then your factory, your ribosome, is going to pick it up. It thinks it's just some mRNA floating around. It starts attaching amino acids and it starts forming proteins. The vaccine mRNA has been very, very carefully modified to make sure that it gets translated properly, to make sure that it doesn't move anywhere. mRNA in nature is actually very, very fragile. So this technology is not that new. We've been working on mRNA vaccines for almost 2 decades, and it just happened to be the perfect example of a great necessity when the pandemic started to finish development. Once this mRNA is translated, you have all these coronavirus spike proteins formed. These then go and they start interacting with special cells in our body that are called antigen presenting cells. These are the first line of defense of our immune system. These then present the information in that spike protein to special immune cells called T cells and B cells. These are subtypes of our white blood cells called lymphocytes. These T cells and B cells then go on to kill the infected cell. The body thinks the cell that made the spike protein from the vaccine has an infection. The body doesn't know that it's a training exercise. So the immune system is going to go and try and kill that cell. And in the process, it's going to learn how to fight coronavirus. So it's going to make antibodies that will hang around. It's going to make special killer cells called cytotoxic T cells that will hang around. So the next time it sees the spike protein from a infection, these will be ready to go and you don't have to start from scratch. And then it also goes and stores this information in memory cells, which hang around for a long, long time, so that if you have an infection a few months or a few years later, these are still there and they can very quickly remember how to make this. You don't have to start from scratch all over again. So that's the advantage of training your immune system with a vaccine, is that it develops memory and it remembers, and then it becomes really good at fighting that infection. So let's talk about the COVID-19 vaccines that we have. In December 2020, the US FDA granted authorization to 2 vaccines, the Pfizer BioNTech vaccine, which is for age 16 years and above, and the Moderna vaccine, which is for age 18 years and above. These are both mRNA vaccines. They do not have any live virus in them, so they cannot give you coronavirus infection. There is no coronavirus in this vaccine. They are enclosed in a lipid nanoparticle. They are preservative free. There is no preservative. What they do is, like we discussed, that mRNA inside that lipid envelope, it teaches our cells how to make spike protein, and that spike protein then trains our immune soldiers to initiate an immune response and to remember how to fight spike protein from coronavirus. So the next time it sees it from an actual infection, they're already trained. That mRNA from the vaccine never enters our nucleus. Our nucleus is where our DNA sits. So it cannot affect or interact with our DNA. To date, almost 2 million people in the US have already been administered these vaccines, and that is pretty amazing, but we still have a long way to go. So let's compare these vaccines. I kept this slide here. It may seem like it's a lot of information, but we are going to go over it quickly. So both of them, the Pfizer and the Moderna, they have about 94 to 95% efficacy in preventing coronavirus infection. They looked across age and sex and race and ethnicity and underlying medical conditions, and they are both very effective, 94 to 95% effective. Both these trials had volunteers from age 16 here, 18 here, all the way to their 90s, and there really was not that much of a difference. These vaccines were good for all ages, both genders, all races and ethnicities. And you can see the numbers. The people in the vaccine group, 8 caught coronavirus, 11 caught coronavirus, versus 162 and 185 in the placebo group. So yes, there were people in these trials that got placebo shots, meaning they got just saline, just diluent, and they went on to catch much more coronavirus infections as opposed to the ones who got actual vaccine. Their body could prevent them from even catching the infection. The Moderna trial also looked at asymptomatic infections, the ones that we worry about, where we don't know somebody is sick, so we can't avoid them. And even those were fewer in the vaccine group, 14 compared to 38 in the placebo group. Both these vaccines had really good power in preventing severe coronavirus infection for sure. So one patient in both trials combined in the vaccine group met the criteria for severe coronavirus. And even this patient, when you look at the trial, he only met the criteria, he or she, but they didn't need hospitalization. They did not need to be in the ICU. As opposed to placebo arm, there were 3 in one trial and 30 in the other trial that caught severe coronavirus infection. So coronavirus infection, COVID-19, it's not a common cold. It is an odd disease, and it can be fatal to many people. What were the most common side effects, right? Because when we are talking about something new, everybody wonders about side effects. And you can see that the most common side effects were what we see with any other vaccine, really. Injection site reaction, a little bit of fatigue, some headache, temporary muscle pain, chills, fevers, joint pains, kind of our common vaccine reactions that are temporary for a day or two. Lymphadenopathy, which means swelling of the lymph nodes, was reported to some extent, and that's not unusual. When we are fighting an infection, a lot of the antigen presenting cells that we talked about, they go to our lymph nodes and they cause them to swell up and become active. So this is actually a sign that the vaccine is working. Now, people are worried about Bell's palsy. So Bell's palsy is a very rare condition that affects the facial nerve. It's like a temporary paralysis. And there were some cases of Bell's palsy seen in both trials, but they were not at any frequency higher than the general population. So people not in the trial also get Bell's palsy. People in the trial get Bell's palsy, and the frequency was about the same. Now, interestingly, everybody has been worried about anaphylaxis since these vaccines came out. But in both these trials, there was no anaphylaxis seen. And these trials had tons of people. The Pfizer and Moderna trial together had more than 75,000 people and no anaphylaxis. What could possibly be considered a serious side effect? So possibly the lymphadenopathy, but it was transient. Possibly shoulder injury if one is not giving the vaccine properly. So it's very important to get your shot from somebody that knows what they're doing, okay? There were some that were likely not related. There was some patients that developed dyspnea with exertion. There was one patient with RA. There was one patient with autonomic dysfunction, but these were probably not related. There was one patient with intractable nausea, vomiting, and facial swelling. You can see common side effects really were very low numbers, less than 0.05%, and they were all things that had nothing to do with the trial. Because keep in mind, we have 75,000 people that we are looking at here from ages 16 to 90s, and they're going to have heart conditions, and they're going to catch pneumonia, and they're going to develop atrial fibrillation, and they're going to have appendicitis and cholecystitis. They're going to have various things happen to them that have nothing to do with the trial. And reassuringly, those were the common side effects, things that had nothing to do with what happened in the trial, just things that happened during the 2 months that they were being followed. What about pregnancy, right? So both the trials did not allow pregnant women to enter. So before every shot, any female participants of childbearing age were given a pregnancy test. And if they were positive, they were excluded. In spite of all of this, several women did get pregnant after getting the shot. So one trial had 23 women get pregnant in vaccine and placebo arm. The other trial had 13 women get pregnant, vaccine and placebo arm. All the vaccine arm pregnancies to date are doing okay. There were some problems in the placebo arm pregnancies, but that again had nothing to do with the trial. So for people that are pregnant and worried about the vaccine, everybody will say there is not enough data, but what I can tell you is, yes, women did get pregnant, and so far those women are doing okay. Their pregnancies are doing okay. What should we do in lactation, breastfeeding? What should breastfeeding moms do? Breastfeeding moms should get the vaccine. The Academy of Breastfeeding Medicine does not recommend stopping breastfeeding if you get the vaccine. Now, think about it this way, right? Coronavirus infection itself, right, the all-out war that we talked about as opposed to a military training exercise, can be very dangerous in pregnancy and breastfeeding. Compared to that, the vaccine is nothing. The vaccine really, there is no biological way that it will cause harm. In fact, if a pregnant woman or a breastfeeding woman develops antibodies due to the vaccine, she may pass that on to her developing child or to her breastfeeding child, and the baby might get some protection from mom. Because remember, babies can't get the vaccine yet. So for people that are at high risk for coronavirus and are pregnant, like healthcare workers and essential workers, you have to weigh the pros and cons. And remember, if you catch coronavirus infection, it does have very poor outcomes in pregnancy. Moms end up in the ICU, babies are born preterm. Compared to that, the vaccine seems very, very safe. Keep in mind, our bodies see foreign mRNA all the time, and this is just one more mRNA that the body is going to see. Pregnant women catch colds all the time, they catch other viral infections all the time, they get flu shots, and the babies do fine. So the fact that it is an mRNA should not scare you. You have to weigh your pros and cons, and if you're at high risk for coronavirus infection, the vaccine may be the better option, so at least you are protected. Now, a little bit about logistics, right? This is not really important for people that are not going to be giving out the vaccine, but there has been much questioning about the temperature at which these vaccines have to be stored. So the Pfizer-BioNTech vaccine has to be stored ultra cold, -80 to -60 Celsius. The Moderna is -25 to -15 Celsius. And everybody says, why this difference? Why so cold? So they have to be kept cold because, like I said, mRNA is very, very fragile. So for people that are worried that the mRNA from the vaccine is going to last a long time in your body, I can tell you it's a challenge to get it to even last long enough to do its job of delivering the message to your ribosomes, okay? But that's why the vaccine has to be kept cold, because otherwise the mRNA will degrade in the vial itself. Why the difference in temperature? So that has to do with how the manufacturers made their lipid envelopes. So think about it this way. Imagine one vaccine has an olive oil coating and another vaccine has a coconut oil coating, right? And we all know olive oil requires lower temperatures to solidify than coconut oil. That's kind of what it is. This lipid particle requires a lower temperature to stay solidified and stable compared to this lipid particle. That's about it. They are both 2 doses. One is 3 weeks apart, one is 4 weeks apart. And they both pretty much have to be given in batches. We cannot have just 1 or 2 people getting the vaccine every day because the vials are only good for 6 hours after opening. So when it is your turn to get the vaccine, you will find that your doctor is going to ask you to come in lots of 5 or 10 patients. Okay, so these were some of the common questions that had already been submitted, okay? If I have had COVID-19, should I get the vaccine? So, data from the clinical trials, both the clinical trials suggest that it is safe and it's likely efficacious in persons with prior coronavirus infection. So vaccination should be offered to people regardless of their history of symptomatic or asymptomatic coronavirus infection. We do not need to test people to check for antibodies, to check if their antibodies have gone down before giving the vaccine. Keep in mind, some people want to know, what if I still have symptoms? Well, if you still have symptoms, it depends on what symptoms you have. So the next question is, if I have had COVID-19, when should I get the vaccine, right? So you should defer the vaccination until you have recovered from the acute illness and you can discontinue isolation. For most people with mild to moderate COVID-19, this is about 14 days from onset of symptoms or a positive test. So 14 days later, you can go get the vaccine. Now keep in mind, there is some thought that if you had COVID-19, most people will not get infected again in the first 90 days after the initial infection. This is what we think. So if you wanted to wait because you had COVID-19, don't wait beyond 90 days. Beyond 90 days, your infection may not have trained your body well enough, and you need that vaccine to retrain the soldiers of your immune system. You don't have to wait 90 days. Like I said, you can get it as soon as 2 weeks. If you wanted to wait, don't wait beyond 90 days. So somewhere between 14 days and 90 days, everybody should get the vaccine, even if they had COVID-19. If you're having certain symptoms like loss of smell that won't recover, you can still get the vaccine, because some of these symptoms are what we now know to be long hauler symptoms, where they are going to take a long time to recover. You do not need to wait to get the vaccine if that is what you have. Should immunocompromised patients take the vaccine? So if you are immunocompromised, either due to a medical condition or due to a medication, and you are stable, then yes, you should take the vaccine. You don't want to take any vaccine if you're having a flare-up of your underlying chronic condition. But if you are stable, your medications are stable, and you are doing well, you should get the vaccine. It is not a live vaccine. It is not going to give you COVID infection. And again, keep in mind, if you are immunocompromised and you catch COVID infection, you are at a very high risk for serious complications. So you would rather take the vaccine and train the soldiers of your immune system to whatever extent they can fight, and help them fight that eventual infection that we might all catch. Now, people have asked me when I will get my shipment, and we are still waiting to hear when our shipment of vaccines will ship out to us. And yes, our immunocompromised patients will be in our first tier of high-risk patients. Some people have read online that the vaccine might sterilize them. There is absolutely no way this could happen, okay? There is no biological plausibility Because think about it. If vaccine were to sterilize you, then actual COVID-19 infection would have sterilized people way worse. And we've seen the millions of people who've already caught COVID-19 and have had no effect on fertility. In fact, if you talk to your pediatrician, they will tell you that their nursery shifts are getting pretty busy because we're about 9 to 10 months out from the initial COVID wave and the initial lockdown, and a lot of babies were conceived during the initial lockdown period. So no, coronavirus infection and coronavirus vaccine has not affected our fertility rate in the human population. What about anaphylaxis? So there were some reports after the trial. Like I mentioned, in the trial we saw no anaphylaxis, but there have been 2 incidents in the UK and 6 in the US of reactions called anaphylaxis, which is basically a severe reaction. So for now, the FDA is recommending that you get your vaccine at a place that can recognize and treat anaphylaxis. And every place that signs up to give the vaccine will be able to do that. We are going to watch our patients for about 15 to 30 minutes. And if you have an epinephrine auto-injector at home because you have a severe allergy to medication or food or vaccine, some other vaccine in the past, please take your epinephrine auto-injector with you to your vaccine appointment. But yes, you should still get the vaccine. There has been a lot of speculation about whether the coronavirus is going to mutate and make the vaccine ineffective. So luckily, because coronavirus is the way it does not mutate as much as, say, our flu virus. So for flu, it mutates every year. We have to get a different vaccine. But coronavirus does not mutate like that, which is very good for us. There has been spike protein mutation noted, but this spike protein is very, very important to the virus survival. So we are not going to see a coronavirus that doesn't have spike protein at all, because the virus cannot survive without the spike protein. It would be like, can a human exist without a brain? No, we cannot. It's an essential part of the virus. So all strains have the spike protein. And it has been pretty conserved because the function of the spike protein changes every time there is a mutation. And if it changes too much, the virus will die. So the spike protein cannot change too much. Otherwise, the virus will just die on its own and then we won't have to worry about it. The mutations that have been noted are tiny, 8 to 10 amino acids. The whole spike protein that the vaccine teaches our body to make is way bigger, more than 1,000 times bigger. So it's like, you change your appearance a little bit with some makeup, the TSA agent is still going to be able to tell that it's you from your picture on your driver's license. It's like that. The immune system is still going to be able to tell that it's a spike protein, even if there are these small 8 to 10 amino acid changes. People have been asking, will we need annual shots like flu shots? So we don't know for sure how often we will need shots to coronavirus. We don't have data. We are still following the study participants. But what we really need is we need to see real world data. So when people like you go out and get the vaccine, then we will know how much of a difference it made. When do reinfections happen? Even now, without vaccination, reinfections luckily seem to be very low. So it's unlikely that we're going to need a shot every year. How long does this vaccine immunity last? Now, the problem with that answer is that we don't know how to measure immunity very well. We check antibodies, right? But they're only part of the picture. So if you think back to our diagram on how the mRNA vaccine stimulates your immune system, antibodies came from the special cells called B cells, but we also have T cells. And we have no good test to measure whose T cells remember coronavirus, how active they are, and how good they are at fighting it. So we really don't know how to measure coronavirus protection. Meaningful measures of immunity will come, like I mentioned, once a lot of people in the community can get the vaccine, right? And then we hope to see a drop in new cases, hospitalizations, deaths, and reinfections. And that's how we will know how long does immunity last? One more point to make. Many people have asked, why will the vaccine cause a more robust immunity than an actual infection? So again, think back to our training exercise analogy. In a controlled training exercise, you don't have other things confusing your soldiers. But in all-out war, there are other things that can confuse your soldiers. Similarly, in an actual infection, our body makes not just spike protein, but all the proteins of COVID-19. And some of these proteins are actually sabotaging our immune system. They are trying to deceive it from mounting a good response to the virus because the virus is trying to survive and our cells are trying to kill it. The advantage of the vaccine is that it does not have any of these sabotaging proteins present. So our system gets a real good chance to learn how to fight the spike protein. A very common question is, if my cells are making this spike protein, will that cause my immune system to start killing my own cells, thinking my cells are foreign, and will that cause autoimmunity? So this goes back to how our immune system develops, right? When we are still fetuses, right, in utero as it is called, all our immune cells get trained. It's like boot camp. They are taught in a special organ called the thymus to recognize our own selves. They literally encounter every protein on every organ and they learn what is their own. Any cells that might be attacking our own proteins just get eliminated before you are even born. So your body has a very good idea of what is your cell and your protein, and it has been trained from before your birth not to attack it. Very rarely autoimmunity does happen when there is a glitch, but it remains very, very rare, luckily. And we are constantly encountering infections, be it coronavirus or flu or the common cold or your strep infection. And our cells are constantly making protein, like we discussed, and displaying it on their surface. And given the millions of pathogens that our body is fighting on a daily basis, if displaying those pathogen proteins on the surface caused autoimmunity, we would all have died in childhood. So I don't think there is any reason to fear that putting the spike protein in your body is going to cause autoimmunity, because then the flu virus would have caused autoimmunity and the common cold you caught would have caused autoimmunity, and we just do not see that happening. So will COVID-19 vaccine cause autoimmunity? It's a theoretical risk. There has been no evidence that this will actually happen, and I don't think that this fear should keep anybody from getting the vaccine, because the infection will do way worse what you fear the vaccine will do. Some people are worried about what is called antibody-dependent enhancement, meaning if you get a vaccine and then catch an infection, will you actually have a worse time dealing with infection? That is not the case. That is seen with some other infections, notably an infection called dengue, which we don't have much of in the US. It is not seen in coronavirus because, like we saw in the 75,000 volunteers in the two trials, the vaccine group had no serious COVID-19 infections. The placebo group had several serious COVID-19 infections. So the vaccine, in fact, protects us very, very well from severe infections. Will the vaccine mRNA integrate into my DNA permanently? No, it will not. mRNA cannot enter the nucleus. And to make mRNA back to DNA, you need a very special enzyme called reverse transcriptase, which we don't have in our cells, and the vaccine doesn't have in it. So the mRNA is just going to go to your ribosome factory, let it make some spike protein, and then it's going to very quickly degrade because it's a very fragile structure. Now, some people think they will wait for the more traditional adenovirus vector vaccine instead of the mRNA vaccine. But keep in mind that adenovirus vector vaccine is going to deliver that COVID-19 spike protein gene via mRNA. So no matter which vaccine you get, ultimately your cells are going to get COVID-19 mRNA for a very, very short period of time, and then the mRNA is just going to degrade. It's a matter of hours to days. It is a very fragile structure. It does not spread. It's not going to go to the placenta. It's not going to be excreted into breast milk. What are the long-term concerns with mRNA vaccines? Really, I think there are no long-term concerns. We still have to wait for data, but think about it. Like I said, our cells are constantly using mRNA to make proteins all our lives, and that is why we are alive. So this is nothing new for our cells. These mRNA vaccines are actually less prone to contamination. They are easier and cheaper and quicker to manufacture, and they are way more precise. Our older vaccines that make the protein or make an inactivated virus or make a low activity virus, they are more prone to contamination because those vaccines have to be made in what are called cell lines derived from animals or human cells in the lab. But then those cell lines contain a million other proteins of their own which they need to survive. And so we are constantly worried about whether we filtered out all the contaminating proteins, got just our spike protein out, did we make the right kind of spike protein, did we by mistake bend it out of shape, will it work in our body? So in that respect, the mRNA vaccines are more precise and less prone to contamination. And a good analogy that I thought of is, think about a friend that has a lot of food allergies, right? And they tell you, oh, I love your lasagna. And you say, well, if I try to make the lasagna for them, a version that's safe for them, avoiding all their food allergens, keeping in mind all their food restrictions, in my kitchen, I will constantly worry about contamination. Did this spoon touch the butter? Did that knife touch the peanut butter? Was there milk here? Did I use this pan to cook eggs? Right? You will constantly worry about the contaminants in your kitchen that your friend cannot eat. As opposed to that, you could just give that friend your recipe, and then they could, in their own safe, allergy-free kitchen, make their dish to their liking, and it will be way safer for them. That is the advantage of mRNA vaccines. They let your cells make the spike protein in a way that's best suited for your body, instead of making it in a foreign cell and then injecting it into your body. So, and these vaccines seem to be very safe. Now, what do we do after getting the vaccine? Can we discontinue social distancing? Can we say the pandemic is over? Can we go out and party? No. We do need to get vaccinated, but even after getting vaccinated, we still need to wear our masks, clean our hands, socially distance, and avoid indoor gatherings with people that we do not live with. Because keep in mind, it's going to take time to go down the tiers and have all the adults get vaccinated. So there will be people around you at all times that are not vaccinated, especially children. It's going to be a while before the vaccine is approved for children, and you do not want to spread the disease to them. So even after getting vaccines, continue everything else you're doing. Then you ask, why get the vaccine? It is because it will really augment everything else that we're doing so far. We are trying our best, and the vaccine is going to be the way to get ahead. So there is a saying, the way to get ahead is to start. And the only way we can get ahead of this pandemic is by taking that first step and getting the vaccine when it is our turn to get it. A lot of my patients have chronic hives, mast cell disorder, and what's called dysautonomia. They are very prone to low blood pressure, high blood pressure, low heart rate, high heart rate. What should they do? Now, these patients, I can tell you, will do very poorly with actual coronavirus infection. So they do need to get the vaccine. They need to train their soldiers to avoid serious complications if they actually catch COVID-19. We recommend that you continue all your medications, all your antihistamines, carry your epinephrine auto-injector, and get the vaccine, because COVID-19 infection will be way worse for you than the vaccine. So this cartoon is about how it sums up my feelings, right? How would you rather face an angry bear? Unarmed or with a weapon? Similarly, how would you face this angry bear called COVID-19? Unarmed or with a vaccine? It makes perfect sense to pick up a weapon and aim it at this bear if it is charging at you. And you would ask me, do I put my money where my mouth is? I absolutely do. And I got my COVID vaccine as soon as my turn came up. I believe it to be very safe, very effective, and this is going to be how we get ahead of the pandemic, in addition to everything else that we are doing. I think now we can go to some questions that have come up. So one question is the COVID vaccine a subcutaneous or an intramuscular injection? It is an intramuscular injection. It goes in your muscle like the flu shot. Now, is it safe for patients with underlying conditions such as controlled hypertension, type 2 diabetes, and post-splenectomy? It is absolutely safe. And in fact, again, these are the people that are high risk if they catch actual coronavirus infection. So they are the ones that should get the vaccine sooner rather than later. Can vaccine be given to a patient with history of recurrent idiopathic angioedema, meaning recurrent swelling? Yes, it can. It absolutely can be given to patients with a history of recurrent idiopathic angioedema. Take your antihistamines, take your mast cell stabilizers, take all your medications. Don't stop them. They do not interfere with the vaccine efficacy. Keep your epinephrine auto-injector on hand. Unfortunately, there is never a medication that will have zero side effects. Even water and oxygen have side effects. But this seems to be very, very safe in terms of its risk-benefit ratio. Is it safe to get vaccines if you already have reactions to medications? It is safe. It is safe to get the vaccine. The majority of patients that have a history of reactions to medications or foods or severe allergies, they are doing okay with the vaccine. The CDC is collecting data from every single patient that gets the vaccine, and we will have more and more data available to us as more and more people get the vaccine. But keep in mind, millions of people have gotten the vaccine, and the reports of severe reactions are still very, very few. So it's not totally unexpected. We have never in the history of humanity ever vaccinated mass populations so quickly with a new vaccine. So it's not unexpected that we will be watching this very carefully. Now, is the Bell's palsy temporary or permanent? All the Bell's palsy cases that were noted in the vaccine and the placebo arm have recovered fully. There were no Bell's palsy cases that were permanent. Now, the next question is, which, if any, other vaccines contain PEG? So I can look up the ingredients. They are readily available on the CDC website, but there are several other vaccines that contain PEG. PEG, for those that have not heard, is a lipid stabilizer that's in both of these vaccines that is being possibly questioned as the reason for anaphylaxis. It has not been proven. It's still a theory, but PEG is present in other vaccines, and so if you've done well with other vaccines, there is a chance that you're not allergic to PEG. Now, Pfizer or Moderna, which is better? And has Moderna had side effects if you had fillers? So it's really like splitting hairs when you compare the efficacy and safety of the Pfizer and Moderna vaccines. They are both 94 to 95% efficacious. All sexes, all ages, all races, all ethnicities. They protect against mild infection, moderate infection, severe infection, possibly even asymptomatic infection. So which is the better vaccine? The one that you can get the soonest is the better vaccine for you. There have been some side effects in people with dermal fillers in the Moderna trial. So 3 people in the Moderna trial developed swelling at the site of their previous dermal filler injections after getting the vaccine. The interesting thing is that dermatologists report that They see this kind of swelling even with viral infections. So there seems to be some pro-inflammatory predisposition at the dermal filler interface with our body. And some people will get swelling with any kind of activation of the immune system, like a flu infection. And likely this is why it's happening with the Moderna vaccine, just because it's stimulating your immune system. But yes, there were 3 cases, and I believe all 3 have recovered. Does the vaccine have egg in it? None of the COVID-19 vaccines have any egg, pork, or any other food protein in them. Which age group is getting the vaccine in phase 1A? So the Pfizer vaccine is approved for ages 16 and above, and the Moderna vaccine is approved for ages 18 and above. Now, phase 1A is your frontline healthcare workers, your ER doctors, urgent care doctors, nurses, your EMTs, and so I'm guessing most of them are age 18 and above. One person asks, I'm 65 with asthma and high blood pressure. Will I be on top of the list? Yes. So you have 3 conditions already that put you in the high risk tier: your age, 65 and above, asthma, and high blood pressure. So yes, once the vaccine is available to give to patients, you will be considered one of the top tier patients. Has there been a study of asthma patients taking biologics and receiving the vaccine? So severe asthma patients were not excluded from the trial. They don't specifically mention if any of their patients were on special injections called biologics, but it was not an exclusion criteria. And there doesn't seem to be any reason why these patients cannot get the vaccine, because our biologic injections for asthma are not immunosuppressive medications. They do not lower the immune system. They are what we call immunomodulatory. They just change your immune system in a way that benefits your asthma. So yes, absolutely, our patients that are on biologics for asthma will get the vaccine. Do asthmatics fall into priority group for vaccine? And if so, when are they eligible? So as soon as we hear that we are able to give vaccine to patients, we will start triaging our patients into high, moderate, and mild risk categories. And yes, asthma will be one of the factors, but the severity of your asthma will also be a factor. So we have to take both into consideration, along with your age and your other medical conditions. Now, I can tell you this. The State Department here in Texas has already sent us a missive saying that we are not to withhold the vaccine if there are no healthcare workers around willing to take it. So once we have exhausted our immediately available healthcare workers, we are allowed to give what vaccine we have to people that are willing to take it. And so that means that hopefully once we get more shipment, once we get our shipment, by that time the healthcare workers should already be vaccinated, and we will be able to open it up to our patients, triage them, and start calling them to come in. If you see an immunologist yourself, please call them and ask them. Maybe your primary care doctor will get the vaccine as well. If you are our patient, we will call you as soon as we hear when we are getting our shipment. Should people with end-stage lung disease get the vaccine? Absolutely, because these people really will find it very hard to fight COVID infection. So you need every little bit of training for your soldiers that you can get to fight this terrible disease. So people with end-stage lung disease should absolutely get the vaccine. There are going to be very, very few cases really where you cannot get the vaccine. And those would be currently if you're less than age 16. And for those few people, 2 and 6, who had true anaphylaxis to the vaccine. We are hearing all these reports of reactions to the vaccine, but a lot of them are not anaphylaxis. So a non-anaphylactic reaction should probably get the vaccine, the second dose of the vaccine. Now, there is a question, can you explain why children are excluded by age? Well, that is because the trials excluded children younger than 16 years for Pfizer, and for Moderna, they excluded everybody less than 18 years. So in general, as a society, we are very, very protective of our children. We always like to test things on grown-ups first, on ourselves, right, before we give it to our kids. Any new food we will try and eat first, make sure it tastes good before we give it to them. And that is kind of the same logic. They are doing trials for age 12 to 16 for Pfizer. So if you have a child in that age group who is interested, you can call around and see if that trial is available for your child. Eventually, we do hope that the vaccine will be available to younger ages. But the main reason it is not right now is because we want to make sure that we study them. And it's always harder to convince people to enroll their kids in a trial as opposed to enrolling themselves. I think those were the main questions that we had. And I would like to thank everybody for logging on, for giving me this opportunity to talk about COVID vaccines. If you have any other questions, or if we missed your question, please leave it in the comments. Please message us. We will try and get back to you. We will keep this recording available so anybody that missed any part of it can go back and watch it entirely. And we will also put up FAQs if there are a lot of questions that are missed, so that you can go back and look at the answers and read over them. Again, the way to get ahead of this pandemic is to get started. So please, when it is your turn to get the COVID vaccine, go ahead and get it. It's very effective and it's very safe. And I think with that, we will log off. It was very good to have all of you with me. Thank you.